stent is about 90 centimeters inside the microcatheter. Loosen the RHV. While holding the stent delivery wire fixed in place, remove the introducer sheath.
So this is where it's just like a coil. You just back off the introducer sheath, set it aside in case you would need to resheath the stent.
Slowly advance the stent delivery wire until the white fluoro saver mark reaches the RHV. Under fluoroscopy, advance the stent delivery wire until the distal stent markers are 1 to 2 millimeters from the microcatheter tip marker. Withdraw the microcatheter slightly.
Remove the slack.
Position the stent for deployment by aligning the stent markers across the aneurysm.
So the big difference that you're going to note here is that there's a distal bumper that's attached to a 19 millimeter pre-shaped tip. And I'm going to go through it tip to hub with you, the whole stent system. But it's going to look different than you do with the Neuroform 3, whether you do an exchange length wire or the stent transfer technique would have no wire at all.
Maintain approximately 4 millimeters of stent length on each side of the aneurysm to ensure appropriate neck coverage. When the stent positioning is satisfactory, deploy the stent by carefully retracting the microcatheter while maintaining the position of the stent delivery wire.
So the other thing with this is just like, it's very similar to a carotid stent, how you want to pin it and unsheath. So a little bit of positive pressure on the delivery wire while you unsheath. Because it's an open cell stent, it opens in segments. So we would recommend is that you let the first set of tines open up. Once they open up, stop and let it just heat up a little bit. It'll affix to the side of the of the vessel wall and then continue to unsheath. So if you were to continue to just go in one movement, you may drag the stent back.
May sometimes help to maintain some forward pressure on the stent delivery wire to ensure it stays put. Do not use the stent delivery wire to push the stent out of the microcatheter while deploying. The stent's distal and proximal markers will expand as they exit the microcatheter. Confirm deployed stent position under fluoroscopy. With the stent fully deployed,
Okay.
distal wire
So that's all I wanted to show you on the video.